I sit on the Health Select Committee and was shocked at what I heard during the inquiry, but it lined up with what is being faced by residents in my constituency. There are over 100,000 people living in my constituency and only 7 dental surgeries, and at least 3 of those aren't accepting any new adult patients. This issue is not unique to Erdington. Across the West Midlands, 73% of dentists aren't accepting any new adult patients. One of my constituents contacted me after a dentist closed down, as she had spent 4 hours trawling through websites and ringing practices and wasn't getting anywhere. She isn't able to afford private dental care, and her son has a serious health condition, which means she requires regular dental checkups. She explained this to every practice she could, but without success. Another one of my constituents had her daughter referred for braces in 2021. After being referred to 3 separate orthodontists, 2 years later, she was told that there is a waiting list of over 1,500 children, which continues to rise. The response I received from NHS England advised my constituents to call 111 for any urgent care services and said they are working to address the challenges facing the service right now. Madam Deputy Speaker, the list of those challenges is long because thanks to the record of this Conservative government, NHS dentistry in the UK has completely collapsed. Over the last 2 years, 6 million adults tried and failed to get an appointment, and 4.4 million simply didn't even try because they knew there was no hope. Rotting teeth is the #1 reason for why children aged 6 to 10 are admitted to hospital, and despite this, 7 in 10 dentists in the UK aren't accepting any new child patients. And shamefully, 1 in 10 people in the UK attempted their own dental work out of pure desperation. Madam Deputy Speaker, that is how my constituents are experiencing the shocking record of this Conservative government. Getting them the proper fund, our NHS is quite literally like pulling teeth. In April last year, ministers promised a dental recovery plan, and in the government's response to our health committee report in December, and I was there, the Secretary of State promised that it would be published shortly. So where is it? Unlike the government, Labour does have a plan which would help people in our communities access the NHS dentistry they so desperately need. Labour would fund NHS practices to provide 700,000 more urgent appointments. It would create incentives for new dentists to work in the dental deserts the Tories have created. And rather than offering sticking plaster solutions, we would reform the dental contract to rebuild the service in the long term. It is becoming more and more obvious that everywhere you look in Britain, nothing works, and our NHS dentistry is no exception. My constituents and people across the UK cannot go on without basic health care while watching our NHS crumble around us. Only the Labour Party has a plan for NHS dentistry, and Madam Deputy Speaker, like a decaying tooth, it is time for this government's extraction. Yeah. Thank you.